Welcome back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today we're going to talk about Liraglutide, also known as Victoza, also known as Saxenda. Two different purposes though. Victoza is for people with type 2 diabetes mellitus, or just diabetes. And Saxenda is for people who are trying to achieve chronic weight gain management, essentially. Control your weight. So, how does it work? So it does separate things. It gets really difficult to explain all of it, so I'm going to go with the two most prominent things that it does, which is it increases glucose-dependent insulin secretion. So depending on what hits the body, so it's in direct response to the food you eat. So, it'll increase insulin secretion depending on how much you've eaten. If you've eaten a lot, it'll secrete more. And essentially insulin is what keeps our blood sugar down. And then also what it does, and this is one of its like special caveats about this medication, is it has decreased gastric emptying. So let me explain that. So when you eat, if everything were to go straight into your intestines would immediately, your intestines are like sponges. They just soak up all the nutrients and whatever you're eating, and it shoots it into your bloodstream. So by gastric emptying, meaning if we slow down the stomach, because the stomach, first the food goes, through our mouth, down our esophagus, into our stomach, and then from the stomach, it slowly empties into our intestines. So if we can slow down the food being in the stomach, one, it'll make you feel full quicker. Two, it will cause less of a sugar spike in your body because it's slowly releasing just a little bit of food at a time. So our body's able to quickly process it and then get ready for like more, and then get ready for more, and then get ready for more. Instead of a whole bunch of food just coming down all at one time, and then your intestines are just like, soak everything up. And that's not good because then it'll shoot everything in your bloodstream. So that's really good, and that's how we're able to get weight control, and that's how we're also able to control your sugar as well, because then we're not overloading your body's ability to metabolize and process all of that sugar and all the food you just ate. And so that's a really cool aspect of it. It works usually in conjunction with other medications. So, if you're diabetic and you're using Victoza, then you're taking several other medications with it to kind of treat diabetes as a whole. Again, treating diabetes is about treating either the number or the disease state. It depends on which philosophy your doctor really kind of subscribes to. A lot of older docs will just treat the number. A lot of the newer docs believe in treating the disease state. And so, this medication, if you're trying to, you can use it for both, but a lot of the newer docs are using this medication because it helps treat the different aspects of that complicated disease state that is diabetes. Because when diabetes goes wrong, there's not one thing wrong with your body. It's a lot of things that are going to start going wrong with your body. And if we can kind of help manage each and every one of those, then that's the best way to kind of keep in control or keep in check your diabetes. If you have renal or hepatic impairment, you need to make sure your doctor knows so that we can kind of adjust the dosages for you. For people who are going to be lactating or going to be pregnant, you need to have a conversation with your doctor about whether the benefits outweigh the risks to this medication. It's still really new, so there's a lot of still like new research that has yet to come out regarding lactation and pregnancy for this medication. It does have a black box warning because it kind of causes thyroid C-cell tumors. Complicated stuff. I'm not going to go into it, but point is just make sure you're getting checked regularly for it. Or if you have a history of like thyroid cancer in your family and your doctor doesn't know about it, they need to know about this medication, or they need to know about your family history, because you shouldn't be on this medication. It's very weird. Like, how does it interfere with your thyroid at all? Again, I don't want to get into it. It gets too complicated. Just know that it's something you need to watch out for. And you need to make sure that you're constantly getting tested for it. If you're a diabetic, then you should be getting tested anyway. You should be getting your A1C checked almost, through every 3 months, every 6 months, depending on how good or bad you are with how, your diabetes treatment. So as long as you're getting regularly tested, it shouldn't be a problem. And I'll put up a list up of the side effects right here. Overall, it's really well tolerated, not a lot of issues. You will see a lot of GI-based issues, a lot of gas, things like that. If they are bothersome, then we can get you swapped onto a different medication. If you have any more questions, please direct them to your doctor, your local pharmacist, or give us a call here at Telfair Specialty Pharmacy. We'd love to talk to you. And as usual, thank you for tuning in. If please leave notes and comments down below. Tell us if there's something that we're not adding in these videos that we should add, because at the end of the day, these are just to help you guys. If these videos aren't helpful, we want to make sure they are helpful, because then why are we making them if they're not helping people? So let us know how we can be more effective. And thank you guys for tuning in, and we'll see you next time on Meds Made Easy. Thanks.